How might you feel like you are finally on your way to overcoming metabolic resistance with increased consumption of glucose and ketones? It all starts with your lungs. Respiratory therapists work in a variety of settings, including hospitals and private practice. They can help offer treatment plans that include chronic obstructive pulmonary disease, asthma, lung cancer, neuromuscular disorders, cystic fibrosis, and many other respiratory conditions. According to the CDC, once diagnosed with asthma or COPD, only 1 in 2 Americans achieves adequate control of their condition. An estimated 2 million people suffer from asthma, and approximately 8 million people have a chronic obstructive pulmonary disease, COPD. Before knowing more about respiratory therapist services, don't forget to hit the subscribe button to never miss our new health plan. What does this mean for you? It means that it's critical that you work with someone who is trained and certified as a respiratory therapist. A respiratory therapist will know exactly what can be done to help you improve your metabolism and, in turn, reduce your risk of suffering from metabolic disease. In fact, an increasing number of healthcare professionals are recognizing the importance of working with respiratory therapists to help people improve their health. You might be wondering, what can respiratory therapists do to improve my metabolism? The answer is, quite a lot. In fact, there are several aspects of respiratory care that can help improve your metabolism. First, respiratory therapists are experts at handling people with acute or chronic asthma and COPD. When you come in for treatment, your therapist will evaluate your condition and create a plan to help you breathe more easily. Second, respiratory therapists can help improve your quality of life by helping you reach your goals. For example, respiratory therapists can discuss the medications you are taking, as well as any other treatments that may affect your metabolism. Third, respiratory therapists can see whether or not medications are treating your dysfunctions in other ways. You may need to adjust the dosages if they aren't helping you breathe more easily. Fourth, respiratory therapists can discuss your diet and exercise habits with you at each visit so that they can evaluate them and create a plan to help meet your goals. Finally, respiratory therapists can work with you to create a plan that will protect your health. A respiratory therapist can help you understand the risks of not doing so and how to overcome them. An example is how to manage your own asthma with proper treatment so that it doesn't worsen into COPD. In other words, respiratory therapists are trained experts who are knowledgeable about the many facets of asthma and COPD, from what causes the condition, to how it affects the body, to how best to manage it through treatment and lifestyle changes. When you need to see a respiratory therapist, the U.S. National Asthma Education and Prevention Program recommends that everyone with asthma and COPD work with a healthcare provider every 6 months. Many commercial health plans also require this follow-up visit, though there aren't any federal guidelines from the government yet to specifically recommend the frequency of these visits. What are the benefits of seeing a respiratory therapist? A respiratory therapist can help you gain control over your asthma or COPD so that you can better manage it in your daily life. A respiratory therapist can help improve your quality of life by providing strategy and treatment options for your condition so that you can have a higher quality of life, as well as significant benefit to your overall health. Metabolic therapy can be very beneficial for people who suffer from COPD or asthma. It helps people to breathe more easily and therefore be healthier and feel better. The respiratory therapy treatments can include exercises, proper medications, a healthy diet, and lifestyle changes. These changes help the body to fight obesity by reducing visceral fat, which is abdominal fat that surrounds your organs. This fat is more harmful than subcutaneous fat, which is the type of fat you can pinch in the folds of your skin. How can I find a respiratory therapist near me? The first step is to ask your primary care physician for a recommendation. If he or she doesn't know of any, try contacting United Healthcare. Alternatively, you can search for a local respiratory therapist at the American Association for Respiratory Care, AARC. How much does it cost to see a respiratory therapy? The AARC has developed an extensive list of questions that you can ask to find out if your insurance will cover the cost of your visit with a respiratory therapist. You should also look for medical facilities in the area that specialize in respiratory care. Look for signs such as respiratory therapist or asthma and COPD. You can also call the facility and ask if it offers respiratory therapy services. If you are eligible for Medicare, you may be able to get a respiratory therapist visit covered. However, like all Medicare services, there is a 20% deductible. For example, if the cost of your visit was $100, you would need to pay $20 before your insurance would cover the remaining amount. Keep in mind that the services that technicians provide will vary according to their state licensing laws and facility policies, depending on where they work. Benefits of respiratory therapy: breathing better. One of the main reasons why people take medications to help them breathe better is because they have asthma or COPD. Respiratory therapists understand this and can help people through a comprehensive treatment plan. Working with a certified respiratory therapist who is trained to help you breathe better can improve your quality of life and overall well-being. Respiratory therapists are healthcare professionals. They are well versed in the important factors that affect your health, such as breathing and fitness. They will ask you questions relating to these factors so that they can determine how to help you improve them. Respiratory therapists work very hard in assessing how well your lungs are working, as well as how fit you are for your age. Respiratory therapists have in-depth training to become certified. They undergo a rigorous process to help them learn how to diagnose the different types of breathing disorders, such as asthma and COPD. Using their knowledge, respiratory therapists can help you breathe easier. Respiratory therapists help people like you breathe easier by modifying medications and procedures in order to give your lungs a break from working so hard. They help you gain control of your breathing by teaching you the best ways for you to breathe properly under different circumstances. Respiratory therapists can help you beat obesity. One of the greatest challenges people with asthma and COPD face is their weight. They may have trouble losing weight and transforming into a healthier, stronger version of themselves. Respiratory therapists can help patients manage their weight through proper diet and exercise. They can also introduce you to new ways for you to maximize your cardio fitness in order to improve your overall health. Respiratory therapists can help you improve your quality of life. To improve your quality of life, as well as protect yourself from other harmful diseases, respiratory therapists help patients better manage their asthma and COPD by ensuring they are not only healthier, but they are happier as well. I hope you enjoyed this video and learned new things about the benefits of a good respiratory therapist for your health. If you have any questions, feel free to leave a comment below. Thanks for watching this video, and if you want more videos on how to boost your metabolism and lose more weight, make sure you subscribe so you don't miss out on future videos.